Ativan side effects can be dangerous. This video explores drug facts, use consequences, and interactions. Welcome to the We Level Up Treatment Center video series. In today's video we will discuss Ativan side effects. Ativan side effects can be mild to severe. The below guide lists some critical Ativan side effects that may occur while taking the drug. This list doesn't include all possible Ativan side effects. Talk with your doctor or pharmacist for more information on the possible Ativan side effects. Find our tips on minimizing troubling Ativan side effects. Ativan abuse. The risks are real. Ativan, also known as Lorazepam, is a widely prescribed medication in the United States for treating anxiety, insomnia, and other related conditions. While Ativan has many benefits for those suffering from these conditions, it can quickly become addictive and cause severe side effects if abused or taken for prolonged periods. The dangers of Ativan abuse, dependence, and withdrawal are often underestimated or ignored by individuals prescribed the drug. However, if you or someone you know struggles with Ativan addiction, you don't have to face it alone. Most common Ativan side effects. The more common Ativan side effects include drowsiness or sleepiness, dizziness, weakness. Some people may also experience less frequent Ativan side effects, such as confusion, lack of coordination, depression, fatigue, headache, restlessness, changes in libido, sex drive, memory problems. In people who receive the Ativan injection, redness or deepening of skin color and pain at the injection site can commonly occur. Some of these side effects may disappear within a few days or weeks. Talk with your doctor or pharmacist if they're more severe or don't go away. Serious Ativan side effects. Serious side effects from Ativan aren't typical, but they can occur. Call your doctor right away if you have any severe Ativan side effects. Call 911 if your symptoms feel life-threatening or if you think you have a medical emergency. Severe Ativan side effects and symptoms can include the following: slowed breathing, respiratory failure, which is rare. Low blood pressure may be severe enough to cause fainting or falls. Convulsions or seizures. Uncontrollable, sudden movements in your arms or legs. Loss of consciousness or awareness. Stiff muscles. Staring spells. Paradoxical reactions. Reactions that cause effects opposite to those expected with the drug, such as aggression, hostility, agitation, or rage. Dependence, misuse, and addiction are more likely in people who take higher doses of Ativan or use it long-term, or those who misuse alcohol or drugs. What is Ativan? Ativan, Lorazepam, is a prescription tranquilizing drug. You might also know it as a sedative-hypnotic or anxiolytic medication. Ativan is used for anxiety treatment. 1. It is in a class of medications called benzodiazepines. It works by slowing activity in the brain to allow for relaxation. Many have succumbed to Ativan addiction, requiring Ativan detox to function normally again and avoid Ativan side effects that bring health risks. Ativan is the brand name available in the US for Lorazepam. Loraz, another brand name for Lorazepam, has been terminated in the US. Ativan is obtainable in generic form, however, you need a prescription from your doctor. Despite its legitimate medical uses, Ativan has known addictive and drug dependence liabilities. This is one of the reasons why Ativan is prescribed for relatively short-term use. However, people should be careful to adhere to prescription guidelines. If not, if an individual exceeds the recommended dosage, it may increase the likelihood of drug addiction development. Ativan is a DEA-controlled drug. The active ingredient, Lorazepam, is a DEA Schedule IV controlled substance. Given that, substances in the DEA Schedule IV have a low potential for abuse relative to substances in Schedule III. The DEA also classifies Ativan as a depressant. Moreover, the street names for benzodiazepines, including Ativan, are benzos, downers, nerve pills, and tranks. Ativan and alcohol dangers. Combining Ativan with alcohol can be incredibly dangerous, even life-threatening. The long-term effects of using these two substances together can damage your health and even lead to death. Ativan and alcohol are depressants that can slow down the central nervous system in your body. When used together, the effects of both substances are intensified, making it incredibly dangerous. Ativan enhances the effects of alcohol, leading to symptoms such as dizziness, drowsiness, difficulty breathing, coma, and even death. We'll explore the dangers of Ativan side effects, including when mixed with alcohol. Learn the risks to your health. Long-term side effects of Ativan. Long-term side effects of Ativan can include cognitive decline, memory deficits, confusion, loss of coordination, and slowed reflexes. The long-term side effects of Ativan may include increasing the risk of developing a seizure disorder and increasing the risk of anxiety, depression, and sleep disturbances. Additionally, long-term use of Ativan may lead to physical dependence and withdrawal symptoms if stopped suddenly. Moreover, when taking Ativan long-term, working closely with your healthcare provider to monitor any possible Ativan side effects is essential. You should also take the medication as directed to avoid any possible complications. It's important to talk to your doctor or pharmacist if you are concerned about any Ativan side effects that you may experience. You should not start or stop taking Ativan without first talking to your doctor. How long do the effects of Ativan last? It should start working about 20-50 minutes after you take it, and you'll feel the effects of Ativan most strongly about 2 hours after taking it. The Ativan half-life is about 12 hours, which means about half of the Ativan you took will still be in your body at that point. But how long does Ativan last in your system? For most people, Ativan will be out of their system within 3 days. However, if you've been on this medication for a long time, such as a few months or more, and developed a high tolerance, Ativan can remain detectable several weeks after taking it. Ativan effects on the body. Ativan also affects physical functions and responses by slowing the brain's and nerves' activity. As a tranquilizer, Ativan can make the user feel calm and physically relaxed. When taken correctly, Ativan can also stop painful muscle spasms or prevent life-threatening seizures. This medication is generally safe and effective for patients who take Ativan as directed for legitimate reasons. However, all users must watch out for potential adverse reactions to the drug, such as daytime sleepiness, low energy levels, confusion, poor muscle coordination, blurry vision, loss of balance, blood in stool or urine, stomach pain, weight loss, chills, pale, cool skin, involuntary movements, tremors, shaking. Since it can cause clumsiness, drowsiness, and disorientation, Ativan increases the risk of accidental injuries. The National Highway Traffic and Safety Administration cautions that drugs in the benzodiazepine family, like Ativan, can cause symptoms that resemble alcohol intoxication, such as loss of motor coordination, slurred speech, visual disturbances, and blurred vision. Driving under the influence of Ativan or performing other activities that require hand-eye coordination and quick reflexes can be extremely dangerous, especially if the user has also consumed alcohol or other sedatives. Ativan effects on the mind. Ativan can have powerful effects on the brain and nerves. However, many users experience rebound side effects or worsen the same symptoms that the drug is designed to treat. In particular, Ativan can cause rebound anxiety, sleep disturbances, abnormal body movements, and agitation. Other side effects can include rebound anxiety, restlessness, loss of pleasure in day-to-day experiences, depression, memory problem, learning difficulties. The chemical structure of Lorazepam is intended to reduce the brain's and nerves' excitability while soothing emotional responses that create anxiety and restlessness. On the negative side, Ativan can flatten users' emotional responses and blunt their experiences of the world. As a result, they may feel constantly sluggish and tired and have a dazed, exhausted appearance. If you or a loved one are struggling with long-term substance abuse and a co-occurring mental health condition such as anxiety and depression, contact one of our helpful treatment specialists today. The Level Up New Jersey Ativan Addiction Center can provide information on dual diagnosis and detox programs that may fit your needs. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.